Welcome to Repromed. This presentation is designed to help you along the path of your IVF cycle. Infertility is common in the community. In fact, 1 in 6 Australian couples experience difficulty in conceiving, with the causes equally shared between men and women. At Repromed, we will do our best as a team to help you achieve your dream of having a healthy child. IVF can be physically and emotionally challenging, but I'm delighted to say that Repromed is achieving pregnancy outcomes well above the national average. This DVD is a practical demonstration to help you prepare for the various stages of treatment that you will go through during your IVF cycle. It will help you understand the processes and the likely outcomes. Our treating doctors, our nurses, our embryologists and our counsellors will help you at every stage of the journey and are always available to answer any questions that you may have.
After meeting with your treating doctor, you will be pre-booked for an IVF cycle. Most people will undertake what is known as an IVF antagonist cycle. There are some variations to this, but these will be discussed as needed on an individual basis. We recommend you commence the appropriate dose of the multivitamin Ivf or folic acid at least 1 month before trying to conceive. Even after you become pregnant, you should continue taking Ivf or folic acid for your own health and the well-being of your unborn child. These medications are easily accessible over the counter from any pharmacy. Prior to beginning the cycle, nursing staff will meet with you to discuss the management plan and demonstrate how to administer the medications. You will need to book this appointment at least 1 week before your period is due. If you require subsequent cycles, you will not need to do this again, but we ask that you ring a week before your period to arrange collection of your medication. It's a good idea to have read Repromed's patient information statement before attending this meeting. At your appointment, nursing staff will use the Ivf Flow Chart to discuss your IVF cycle from day 1 of your period up to the pregnancy test or cycle end. Day 1 is the day you have a full flow period before midday. If it occurs after midday, day 1 will be the following day. When your period begins, you should call the Repromed book online on 8333 8150 to activate your pre-booked cycle. You are able to leave a message 24 hours a day, 7 days a week. If you do not speak with someone straight away, leave a message stating your name, patient number, the date your period has commenced, and that you need to book on for an antagonist cycle. Most importantly, leave the phone number we can contact you on in the next 24 hours. Repromed will call you back within 24 hours to instruct you on the first few steps of your cycle. Initially, staff will confirm day 1 of your cycle. From here, we can determine the day to start your FSH and antagonist medications. Your first blood test and scan will also be arranged at this time. When undertaking an antagonist cycle, your FSH injections or follicle-stimulating hormone will start on day 2 of your cycle. This medication is designed to stimulate the ovaries to produce eggs. The injections will be either Puragon or Gonal F and given by subcutaneous injection. The best place for the injection is in the tummy area, away from the navel. We recommend that you use a different spot each day. FSH is easily injected using a pre-filled pen device. The nurse will teach you or your partner how to give this injection. It is best given in the evening. Some people may experience side effects from the stimulation hormone injections. They may include mild nausea, pain at the injection site, sore breasts, tiredness, cramps, dizziness, or headaches. The most common reaction is a feeling of being bloated in the abdomen. You have information leaflets in your medication packs, so please check these if you have any concerns. On day 7, you will begin the antagonist drug Orgalutran in addition to your FSH. Orgalutran is given to prevent spontaneous ovulation as your eggs mature, and it must be taken regularly each night between 9 and 10 p.m. It is in a pre-filled syringe and injected into your tummy the same as the FSH injections. The Orgalutran is a little more difficult to inject than the pen system of Puragon or Gonal F. It requires more pressure, and some women like to place an ice pack on the skin to create some numbness before injecting. It may create some redness and short-term itchiness around the injection site, but this should resolve within an hour of giving the injection. Remember, you should have the FSH and Orgalutran injection each night once you have started them, and please put them in different sides of the tummy. Around day 10 of your cycle, you may have a blood test and transvaginal scan in order to determine your response to the medication. The blood test, if required, is to ensure the hormone levels are appropriate. The scan will identify the number of follicles and the thickness of the uterine lining. Follicle number does not necessarily determine the number of eggs that will be collected, but it will give us an indication. Normally, we aim for 6 to 12 eggs, but every patient is different. Any time that you have presented to the unit for a blood test or scan during a cycle, you will be rung later that day to discuss your results and the next step for that cycle. On these days, it is important that we have a number that we can contact you or your partner on before 5 p.m. If the response to stimulation is not ideal, for example, too few or too many eggs, your doctor may recommend cancelling the IVF cycle. If this is the case, an appointment will be made and your doctor will discuss this with you. Depending on your response, a blood test or scan may need to be repeated, or you may be ready for your egg collection. Once it has been determined from the scan that you are ready to have your eggs collected, it will be arranged for you to go to theatre. Most patients will go to theatre around day 13 or 14 for egg collection. Nursing staff will clearly instruct you about when to cease your FSH and Orgalutran injections and when to administer the trigger injection. You will have received a theatre planning sheet with your medications. It has spaces to enable you to fill out dates and times given to you. It also provides information such as fasting times, where to park on the day, and what to bring to theatre. An appointment is also allocated at this time for your partner to give his sperm sample. In a normal menstrual cycle, eggs would be released. However, in an IVF cycle, this does not occur because of the effects of the Orgalutran. Hence, you will have a trigger injection of a drug called Ovidrel 36 hours before theatre. Ovidrel will ensure the egg is released from the side of the follicle wall and is floating in the follicular fluid so it can be collected in theatre. It is very important to have the Ovidrel injection when advised by Repromed, that is 36 hours prior to your egg collection. Ovidrel comes in a pre-filled syringe and you inject it into your tummy like the other medications. Sometimes it can make you a little tired and create a little abdominal cramping. When you come in for egg collection, our day surgery staff will take some initial observations and the anaesthetist will meet with you. You will walk into theatre, get onto the theatre bed, where the anaesthetist will put an injection into the back of your hand and this will put you to sleep. It is only a light sedation and you will wake up fairly quickly. While you're in theatre, the doctor will use a similar probe used during the ultrasound scans, but it will have a needle attached to the side to enter the vaginal wall and the ovary. The needle will be put into the follicle, and the fluid inside, including the egg, will be drawn into a test tube. The doctor will aspirate all follicles and give the test tube to an embryologist. Using a microscope, an embryologist will look for eggs in the fluid. The number of eggs we have collected will be written on the palm of your hand, so you will have this information when you wake up. You will be in theatre for about half an hour before waking up in recovery. You should be able to go home about an hour and a half after theatre. You must not drive, operate machinery or sign legal documents for 24 hours after theatre, and you should have somebody with you overnight. Our doctors can give you and your partner a medical certificate if it is required for work. Sometimes you may experience some abdominal discomfort, a slight vaginal discharge and tiredness following the anaesthetic. If it is more severe than this, you should let us know. Usually, your partner will produce his sperm sample around the same time that you go into theatre. If the male partner has had a vasectomy or has a known low sperm count, a surgical sperm extraction may be undertaken. You can bring in your own sample, but you must ensure it arrives within half an hour of it being produced. If you have any concerns, please speak with andrology or nursing staff and they will be able to advise you. Remember, it is important for him to abstain from ejaculation for 2 to 3 days, but no longer than this before producing this sample. If you are having IVF, our laboratory staff will put the egg and the sperm in a solution called media and place it in an incubator, leaving it overnight to see if fertilization occurs. If you are having IVF with Intracytoplasmic Sperm Injection, otherwise known as ICSI, the laboratory staff will select an individual sperm and inject it into the egg. It will also be placed in a medium and then into the incubator. The day after theatre, you will be called with information about how many eggs have been fertilised, and your appointment time for embryo transfer will be confirmed. Occasionally, this time is changed to give the best opportunity for your embryo to grow to its full potential. After 2 to 5 days, an embryo will have reached the stage that we plan for embryo transfer. The best time for embryo transfer will be planned by Repromed. The embryo transfer is a simple procedure done under abdominal ultrasound guidance. We like to have you in about half an hour before the transfer and ask you to drink water to have fluid in your bladder, which will enable the doctor to see via the ultrasound where the embryo has been placed. You will go into a transfer room where the embryologist will show you a picture of the embryo before it is drawn from the medium and into a transfer catheter. The embryo transfer is like having a pap smear. A speculum will be placed into the vagina so the cervix can be viewed. This allows the doctor to pass the catheter into your uterus, and it is guided by an abdominal ultrasound. The embryo is expelled via the catheter to the uterus. Following the transfer, you can return to your normal activity, for example driving home or going into work. You can also resume intercourse if you wish. The second stage of the cycle is known as the luteal phase. In a normal cycle, the natural release of progesterone would ensure the lining of the uterus is nice and thick, with a good supply of blood to encourage the embryo to implant. To assist this occurring, we provide some medications following egg collection, and you will also be given a sheet of instructions to guide you. Medications prescribed can vary depending on your individual needs. Your doctor will decide upon the best treatment for you. Some people will receive a box of crinone, which is a vaginal gel, and you should administer the gel every night for 15 nights before you go to bed. There can be some side effects from the crinone, such as vaginal discharge, but you should continue to administer the gel. The crinone may also give you sore breasts and abdominal cramps, similar to premenstrual pain. You may also feel a little flat and emotional. If you are given crinone, you may be prescribed some additional medication by your treating doctor. Alternatively, you may be given 2 injections of Pregnil to take in the second stage. These injections involve mixing a powder and water to make a fluid that is then injected in a similar manner to the stimulating hormones. These injections are taken on the 4th and 7th day following your egg collection. These provide additional progesterone support and help to build up the uterine lining. Occasionally, an alternative medication regime is utilised in the second part of your cycle, but your doctor will discuss this with you if it is required. 19 days following your egg collection, we will ask you to come in for a blood test if you have not had a period. This blood test is to check if a pregnancy has been established. It is important to understand that if you do not have a period, it does not necessarily mean you are pregnant. The medications may actually prevent you from having a period. Your period may occur when you stop taking the medications, as your hormone level will drop. If prior to that day you get some spotting as distinct from a full flow period, we still ask you to come in for a pregnancy test. You can get some spotting in early pregnancy. If you have had a full flow period before this time, this indicates the IVF cycle has not worked, and we ask that you phone the nursing staff to let them know. At this stage, it is often very helpful to discuss your feelings and remember that Repromed has trained fertility counsellors to assist you at this time. There is no additional cost to talk with our counsellors either in person or on the telephone, but an appointment needs to be made. Some say the hardest part of the cycle is in the last 4 or 5 days. The crinone can make you feel like you are getting a period, but this may not be the case. When we do the pregnancy blood test, we look for the level of human chorionic gonadotrophin, or HCG. This is a hormone secreted by the placenta. If the levels of HCG are in the predicted range, you are pregnant. Congratulations! Nursing staff will arrange a scan around the 8-week mark to confirm all is well, and you can then move on to your obstetrician's care. If the HCG level is low, the blood test will be repeated, as it may indicate there are problems. If this is the case, nursing staff will discuss this with you and assist you through this difficult time. If the cycle has not resulted in a pregnancy, you may have some frozen embryos that can be used for future cycles. This option, along with others, will be discussed with you by your treating doctor at your review appointment. Your IVF cycle is carefully planned by your treating doctor to specifically meet your medical needs. However, it is important to be aware of the medical condition called Ovarian Hyperstimulation Syndrome, commonly referred to as OHSS. This occurs in some women who have an unexpected overreaction to the stimulation medications. The symptoms most commonly appear in the second half of the cycle, after the eggs have been collected. They may include abdominal pain and discomfort, extreme abdominal bloating, nausea and vomiting, diarrhea or constipation, shortness of breath, swelling in the legs and genital area, or reduced urinary output and urine darker in colour. OHSS can vary from mild to severe, and it affects about 1 in 20 women. During your IVF cycle, it is important to drink plenty of water, at least 2 to 3 litres each day, particularly after your egg collection. Nursing and medical staff will be observing your results to look for early indications that you may be at risk. But if you have any or a range of these symptoms, please contact Repromed immediately or go to a local emergency department, for example the Women's and Children's Hospital.
We hope that this DVD has given you a good idea of what to expect during your IVF cycle, and we wish you all the best in achieving your own dream.